the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
My hearing aids can't hear very well. Welcome everyone to the Board of Health. Approval of minutes will have to be tabled as we do not have a quorum to vote on the minutes.
Right.
Citizens' time. Is anyone here who has issues or concerns that is not on the agenda to raise for the Board of Health? Hearings. Adoption of Burlington Board of Health minimum standards for the keeping of animals. Director.
Yes, thank you. So these proposed regulations are intended to replace our current Board of Health regulations. We have met with the subcommittee, which consisted of Mary Beth, David, myself, and Samantha, and had a meeting on January 23rd, which the meeting minutes are included in your packet. And we also, Samantha and I met with the animal control officer prior to that meeting to discuss any concerns that he might have. He really didn't have any concerns. I think he was happy that we were doing this and looking at these. So when do these regulations apply? So I'm going to do a comparison between our current regulations and the proposed regulations. So with the current regulations, it states for certain domesticated animals, and the proposed are for domesticated animals with exclusions. So the current regulations specifically mention certain animals. So it mentions chicken, fowl, wild animals, pigs, horses, donkeys, mules, ponies, alpacas, bovine, goats, llamas, and sheep. That's everything that's mentioned in the current regulations. The proposed regulations applies to all the domesticated animals, and it gives you a definition of what a domesticated animal means. And that means that the definition is animals domesticated by humans to live in a tame condition and depend on them for survival. And it excludes household pets, research laboratory animals, and non-exempt wild animals. And it also gives a definition of household pets. So the definition of a household pet means an animal that's living inside the home. It also, for the number of animals, so our current regulation talks about specific animals based on land area. So you can have no more than one horse, donkey, mule, pony, alpaca, bovine, and no more than 2 goats, llama, swine, or sheep on 0.5 acres of land.
How many alpacas do you have on your property?
Alpaca?
Yeah.
Not more than 1 per half acre.
There you go.
So it also states that you can have no more than 25 chickens or 6 other fowl, or a total of 31 fowl on any residential lot. So the new regulations, or the proposed regulations, say apply to if you have 1 or more animals, you need a permit, and it leaves the number of animals on any lot up to the discretion of the board.
Does that also tie into this, which I'm sure you're gonna get to, this best management practice
Yes.
consideration? Because if you wanna have 30 animals and you cannot manage them appropriately, then that doesn't make sense.
Right. And it also allows, you know, the board may grant a permit, and then if the permit holder cannot manage that amount of animals, they can then suspend or revoke the permit.
Got it.
Or change it, or modify it as well.
So, when I looked at the Reading, Stoneham, Lexington, and Saugus, some of those communities call out poisonous snakes.
Mm-hmm.
Now, there are people that I know who are very responsible, who have snakes, who take care of and have pets of snakes, poisonous or not. But I just was wondering, now, if this new regulation involves all animals, then does it pertain to snakes also?
So a snake, I would consider to be a household pet because it's living in your home. It's not gonna live outside in our conditions. So then it would fall under the category of household pet,
So-
which is excluded under the proposed regulations.
So poisonous snakes are excluded.
If it's a household pet, or unless it falls under the wild animal exemption, which it depends on, I think, and Sam knows these best management practices very well. So do you remember if there's snakes under the wild animal?
I don't care about
We looked at
snakes,
the wild
poisonous
animals
snakes
before.
as an example.
Well, as an example, there may be some poisonous snakes, I don't know if it's
There
all of
are.
them.
I don't
Under the
think it's every
wild
single
animal part of it, and therefore, if you have a poisonous snake, you wouldn't come to the Board of Health, you would then have to go to the state to get a
Yeah.
permit.
Yeah, so things like, you know.
I just want, because
Hondas, I'm
they
pretty sure you
call it
can.
out under their community regulations. I was wondering then how it pertained here.
Yeah, so when we looked at that, there was no need to do that because they fall under those exclusions. And there's a list of wild animals that also fall under it. I forget what they all were, but there's quite a few.
There's a list of animals that you need to have a.
I just was wondering why they called them out.
I don't know, yeah.
Okay, thank you.
Susan, maybe,
yeah.
are they, and you did a wonderful job. I want to, Samantha, I thank you. It was very clear providing your documentation to the subcommittee, so I want to point that out. It really helped us move through the meeting. And just curious, as I look at the table where Ed was talking about Reading, do they state, and do you even have that information, that they're following the best practice as well?
I don't think any of them do.
Okay,
No, some of them have had their own version of it,
okay,
where they
and
would
that's
say
great,
you
because that's
have
what
to
we're
have.
following, right?
Yeah, so they would explain certain things that they required, but it wasn't necessarily the best management practices that
okay.
we're referencing.
Thank you.
So, like I was saying, the current regulations allow limitations on the number of animals. So it's based on land requirements, or in the case of fowl, it calls out specific numbers. The board would be able to limit the number of permitted animals based on your discretion. So if you thought that somebody shouldn't have 25 chickens, you could say, well, they can have 2 or 5, or whatever your discretion is at the time. And then also for the notification requirements, the current regulations require a legal ad be published in the newspaper and notification of the public meeting be sent to everyone with a quarter-mile radius, which is huge. So it is just not doable, it's not cost-effective. The legal ad is the same thing, that's very costly to put in a legal ad. We don't do this for notification on any of our regulations. I don't even think we saw legal ad in any other town's regulations. So in the proposed regulations, what we're suggesting the notification requirements be direct abutters. So anybody who is directly abutting the property, because we feel like someone, 10 streets over don't really need to have notification. And, it's all on, our meeting agendas are all posted anyways.
So does this mean that by right, anybody could, if we pass this in the past then, in the previous regulations, had a by right to have 3 chickens, now they still have to come to this board?
Right.
Correct.
If they have 1 chicken, they would have to come and get a permit. And there's no grandfathering as well, so if we know of someone who has 1 chicken, they would still have to come to the Board of Health for a permit.
Maybe we can have a fowl day and have everybody come together, because we have a lot of people in this town who have chickens.
And, yeah, we don't necessarily know about all of them, so if someone called up and let us know and we could see them from, the street, we would notify them.
And the last question, which I wasn't clear here, and I'm sorry, I wasn't clear here, is if someone has 3 chickens or 6 chickens and they come and they've not had any problem whatsoever, can their permit be administratively continued or renewed, or do they have to come before the Board of Health?
No, it would be administratively, so they come to the Board of Health first, and then there would be renewals. And we would bring them before the board only in the event that there was some problem or issue, and we felt that their permit needed to be suspended or revoked.
Okay, I have one more question later. Thank you.
Okay. for the general requirements on the setbacks. So the current regulations now state that, coops or wherever you're keeping the animals need to be 25 feet from the property line. The proposed regulations, state that it should go according to the zoning regulations. So the town of Burlington zoning regulations require that all structures are at least 15 feet from the property line. So it would go from 25 feet to 15 feet. With regards to the building used for human habitation, currently it's 75 feet from the building, which would be the house or the home. And the proposed regulations have no recommendations on the number of feet. So we couldn't find any recommendations or guidelines in all the best practices on applying setbacks from existing dwellings. We're not sure why that was in there to begin with, why it's 75 feet. Most people can't meet that 75 feet, as you know, because they all coming for variances from the 75 feet requirement, because people just don't have enough property to meet that. And again, we weren't sure why that was even in there, what the 75 feet meant. The subcommittee did have some concerns, though, about pens being attached to a house. So in order to address that, we added wording to section 6A in the proposed regulations, which says that all structures for the housing or confinement of animals must be a freestanding structure. So in other words, you cannot connect it to your house. And then we also added a definition of what freestanding structure means, which is a structure that's not supported or attached to another structure. So that's kind of how we address that. So if you have it, you can have it 2 feet, 3 feet, 4 feet from your house, as long as it's a freestanding structure, therefore not attached to anything else.
Yep.
Okay. With regards to runs and roaming of animals, in the current regulations, there's no limitations on that, so it doesn't say anything about runs or letting your animals roam. The proposed regulations require that permitted animals must be confined to the property for which the permit is granted, unless you grant permission to let them have the animals roam somewhere else. So for instance, they might come and say, well, we have, I don't know, some conservation land in the back, we want to let our animals roam in. So you can grant that or not grant that. But otherwise, the animals have to stay confined to their property. So here's the general requirements or the best management practices. So the proposed regulations integrate best management practices for the housing and keeping of animals. So in your materials, the best management practices are in this manual here, which is the Department of Agriculture manual on best management practices. This talks about every single animal that you could keep is in this, and it's in the best management practices. Our current regulations talk about, it does mention some best management practices. So for horses, you should give them this vaccine or that vaccine. But we, after looking at this, this covers it a lot better than what we could ever cover in a regulation. So if we refer to this, we're covering every single animal. And if any of those best practices change, then they would change along with this animal manual, and we wouldn't have to then change our regulations. So that was the reason for doing the best management practices. The model regulations define best management practices as methods generally recognized by appropriate professionals to be an effective and practical means for the housing and keeping of animals. And at the subcommittee meeting, we changed that definition to replace appropriate professionals with Mass Department of Agriculture, because there was a discussion around who is the appropriate professionals. So then we define them as Mass Department of Agriculture. And that's it. Any other questions?
Last question around enforcement, Mr. Chairman.
That's exactly what I was going to ask.
A non-criminal disposition process is provided in MGL 40, 21D, and Burlington's non-criminal disposition bylaw says that we can revoke a permit after a hearing. What are we doing what if we have a situation, and I know that we have not had this situation yet, and it may fall under the purview of the animal control officer. But if our health professionals go into an area and it's squalor, it's a real problem, in a house, we can condemn it right away. How come we can't condemn it without waiting for a meeting and providing a fine? I'm a little concerned about the fact that you may go into someplace and it's so bad, we should be able to revoke immediately without having to call a meeting. Can the animal control officer revoke, or can the animal control officer order immediate action?
Yeah, so the animal control, if it was that type of situation, the animal control officer could then step in and, seize the animals, or call the appropriate, another agency or whatever to do that. So if we did have that situation, that's who our first phone call would be to the animal control. And then we would set up a meeting to revoke the permit, so they wouldn't have the animals back there, and they wouldn't have a legal permit to keep the animals.
Thank you.
There is if it isn't that type of situation, so say it's the situation where, maybe they're just letting their animals roam too much, and, the Board of Health have asked them not to do it, and they're not complying, and you revoke their permit or suspend their permit, they're the ones that responsible for rehoming or finding a place for the animals, so they would have to do that. So maybe they would keep them somewhere place else temporarily if you suspended their permit, or find a permanent home for them if they had to.
And how do we enforce that happens?
So that, we would have to go out and make sure that that's actually what they did, and we would work with the animal control officer to do that, because he has, authority in that area as well.
Because at the end of the day, we don't have, we can fine, and this will come up later, we can fine, we can assess, but at the end of the day, we are not an enforcement body.
Yeah, we're not gonna go and, take someone's animal away, but the animal control officer.
Yeah, okay.
And we have a good relationship with him, like I said, and he's on board with this, so. We
Great.
did talk to him about that, I believe. Yeah.
Okay. So you want a motion, this needs to be approved, or can we just say yay?
No, we have to vote
Yeah.
on this.
We vote?
So, one vote to adopt these regulations, and then a second one to rescind the current regulations.
Let's just say thank you to our associate health inspector for all the legwork on this. Thank you very much, Samantha. The chair will entertain a motion to adopt the new Board of Health minimum standards for keeping of animals.
Mr. Chairman, I'd like to hear from the subcommittee first.
Okay.
Thank you very
well,
much.
Thank you. So, again, I agree, I wanted to thank Samantha for her research. I think that she did a wonderful job bringing the data to us. I think it was, our regulations were a little outdated from the surrounding communities. I think it brings us moving forward, not just for the applicant, but for all residents. I think it's really helping us to, and as, I don't want to use the word, we can't, as a Board of Health, unfortunately, there are some residents out there that may be, may have one chicken, and that's fine, or 1 to 3 in the previous regulation, but this is actually following the best practices that we read and that we reviewed. It kind of allows us to provide a little bit of a guidance from our board, and hope that the residents are following what's in this guideline.
I think that the subcommittee did a wonderful job, thank you.
Well, thank you. I think most of it was, I think having, just what I said, having this guide that you can present and provide to the residents when they come forward for the permit, Yeah, I think it was a lot of research to look at what the surrounding towns, but thank you, Ed. I think it was, I think that the documentation that was provided us was very easy to review and to make recommendations, so. I did have one question, but thanks, Ed, for asking, is, we do, is it yearly still, Susan?
The inspections?
Yes.
Yeah,
Great.
so Samantha does those.
Right, and I think, again, I think most that have come in front of us, they do a wonderful job with, you've seen, I'm impressed. So I think it's just gonna help us with other residents that are looking for, you know, guidelines, recommendations from our board, and it's for all, to keep us all safe.
We care about the animals in our community. I think that's the most important.
And
We're not
that's
doing
true.
this. We just care about our domestic animals and our wild animals in this community. Okay, I move that we adopt the Board of Health minimal standards for the keeping of animals that have just been proposed. Do I have a date on those?
It would be upon publications.
Upon publication.
I second.
Motion is second. Any further discussion aside from poisonous snakes? Seeing none, all in favor?
Aye.
3-0. Chair will entertain a motion to rescind the previous Board of Health minimum health standards on the keeping of animals.
I'll make a motion to rescind the previous Board of Health minimal standards of keeping of the animals.
I second.
Motion is second. Any further discussion? Seeing none, all in favor?
Aye.
3-0. Thank you very much. Again, environmental engineer. Good evening, Christine.
Good evening.
So Christine, I have a question, and I know you've already spoken with Dr. Weiner about this, but I have a question about the Maycomb site. So my understanding is 9 wells tested, 2 wells were below the levels of volatile compounds detected, but 7 still were above our standard levels. So it's not so much a question about remediation as it is about the longitudinal impact that we have on our environment. And this is a really good example, because this has been an issue now for how long, Dr. Weiner?
I've been on the board 30-plus years, and it's been a 30-plus year issue for this board, or more, much, even 35, 30, or 40 years.
So 40 years after damaging our environment, we are still dealing with this. Oh, 8 wells, okay. I guess my question is this going to clear 40 years later, or are we going, is this going to be just an ongoing remediation that we're just going to be living with? I think, I just want the community to feel the impact of what can happen when our environment is tainted like this.
Sure, so this site is actually quite large, and it has several, in its heyday, Maycomb occupied a lot of area in what is now Northwest Park and Third Ave area. The main area being where Keurig is now, and some of their operations in the late 50s through the, I'll say, late 70s in that area contributed largely to the contamination that you still see moving in our environment, as you expressed. They have cleaned up a lot of the original impact by removing source areas of contamination. So the metals contamination has been cleaned up. The former PCB contamination has been cleaned up. What they have there is some persistent VOCs in groundwater that are isolated in basically a couple of areas. And they are they're deep under the ground. They're hard to get to. And over time, they're doing chemical oxidation treatment periodically, and then they test to see if that did any good, and they test, repeat. But yes, it can take, 40, 50 years for remediation of some of these impacts, especially when, you're down 60 feet, and, you can't dig through 60 feet of bedrock and get to all the veins in the fractured bedrock where you're still finding, these VOC hits. And they're just particularly persistent chemicals. These, they start to break down, in this case, you start with like a TCE, and you do see breakdown products, which means it's getting there, but it can take decades to get all the way from TCE down to no more contamination.
All right, I have another question. Regarding vegetation management, the herbicide treatments, it's a letter to William Hayes, the arborist. So, two things, because we as a board have been talking about wells for a long time. So, in this town, we have wells that are for drinking water, not just for irrigation or not just non-potable wells. We actually have potable wells.
A few, yes.
And so so given that we have what looks like 12, it looks like we have at least 18 in town. How does that change the administration of herbicides, or do we have any concerns about the impact?
So the Eversource does vegetation management along the transmission lines, and they just ask us annually for an update of what we know to have for private wells, and they look at within, I think it's 500 feet. None of these 18 wells are within that, but I just update them annually on the wells that we know to exist. So they manage the vegetation along the right-of-ways to prevent damage to the, transmission lines and,
Yeah.
and natural gas pipelines and whatnot. So it's just an update to them annually that, there's no new well near where they're gonna be
Okay.
applying herbicides.
And we can't request, I know they must exist, we can't request a more organic or non-synthetic or harmful herbicide? It is what it is?
Yeah, I don't know what our rights would be
Just,
to.
I was just wondering, in today's world of trying to get away from synthetic, potent, things like that, just wondering. Okay, thank you.
But it's an infrastructure issue, as you might imagine. They have to be able to maintain
Yeah.
the.
Nope, I understand.
On James Street, we had a residential release. How big was it?
180 gallons of home heating oil
And
into the basement of the residence, which got through cracks in the slab and entered the environment. I don't know the extent of, radial contamination or depth because they haven't completed. They've installed wells, and I believe the sampling's been done, but I haven't seen the results yet.
thank you.
And you don't know if we had the same question, is it just contained to that?
I don't know.
You don't know yet?
I mean, they, when I visited the site a couple days after it happened, they were literally hammering the basement slab and removing chunks and chunks of the basement slab into, a container outside the house by hand.
Wow.
And to access and contain what they could,
What a shame.
yeah.
And was this because somebody delivered oil to a,
Unfortunately, in this case, the system had been inspected maybe a week before, and they did a routine delivery, and there was a pinhole, a pin-sized hole in the tank, and it just ruptured when they delivered the 180
What a
gallons.
shame. Well, we hope everybody is safe and okay.
Yeah, it's a good thing to look to see if your homeowner's insurance policy covers it, because if you don't attach it specifically, it's probably not covered. In this case, this homeowner was lucky. It was reported to me that it is covered by their homeowner's insurance, but it's a good thing to look at, because we had one a couple years ago, right around the corner, where they did not have that rider on their insurance policy, and, I mean, I know from speaking with that homeowner, that they basically spent their retirement cleaning it up, their retirement funds. So,
What a
it's a
shame.
good thing to check.
What a shame. Any other points of interest you want to point out?
I just wanted to highlight, Household Hazardous Waste Day is April 13th, 8:30 to noon, same place at the Francis Wyman School, 41 Terrace Hall Ave.
Very good.
Thank you for, I had that, thank you for bringing that up, Christine, and I was just gonna ask, Susan, has communication gone out, like social media? Because I've had a few people ask me.
I think Sam does the social media, so
Yeah.
Great.
I think I put a couple out, so but I won't put more.
Okay,
They'll be
great,
out there.
thank you.
Any other questions for our environmental engineer? If not, the chair will entertain a motion to approve her report.
So move, Mr. Chairman.
Second?
Motion is second. Any further discussion? Seeing none. All in favor?
Aye.
3-0. Thanks, Christine. Health agent, good evening, Marlene.
Good evening. So I wanted to update the board on the updated food code. That Massachusetts adopted a newer version of the FDA food code. And Samantha and I have been working diligently. And as we do our inspections, we've been going over all of the changes. And as I discussed in a previous Board of Health meeting, this code really focuses on employee health and the importance of reporting if you're ill, understanding that you're not supposed to be working when you're ill. We had our digital health department, that's our software on our computer, on our laptops, updated, so that was installed just last week. And so we're using that now because we have a 3-page inspection report versus a 2-page with this new update. And the vomit and diarrhea cleanup procedures, we're working with folks regarding that. And also their cleanup kit that goes along with that.
Hope pleasant.
I know.
No questions, Mr. Chairman.
Question?
No, I don't. That was outstanding.
How many food trucks are we expected this season? Do we have an idea?
That's always a good question, because they don't all come back every year. So I will be doing the inspections the last week of March. I know we'll have our 2 canteen trucks. I know we'll have our 2 ice cream trucks come back. We have a couple of popular folks, chicken and rice guys, they'll be back, and
I think you have like
Chicken
15
on
or
the
something.
road.
Yeah.
Do they go to a certain site,
some do. They get invited onto private properties where
Private,
office
okay.
buildings are located, and they will switch off. They might be there Tuesdays and Thursdays, somebody else might be there Mondays and Fridays, so they have some sort of a schedule they work out with the property management.
Got a Mexican truck, you got a tandoor and curry on wheels, I got just Sachko.
A lot of
Delicious.
variety. And they also participate in some of the town events. They celebrate Burlington. The Recreation Department, a couple of years ago, they started this food truck day, and so they'll invite the food trucks there. So they,
and is that the same as when you do spot checks for restaurants? Do you have to do the same for a food truck?
yes, because the same regulations apply to them as well.
All right, thank you.
You're welcome.
Great.
Mr. Chairman, I move that we approve the health agent's report.
A second?
Motion is second. Is there any further discussion? Seeing none, all in favor?
Aye.
3-0. Thank you very much, Marlene.
You're welcome.
Director,
How about the associate health inspector?
do we have an associate health inspector report?
Yes.
Excellent. You mean the one that's here on the agenda that I just skipped
Yeah, 'cause
over?
I have a question.
Yeah,
I do
excellent.
too.
Associate health inspector report.
This is kind of a big report because it carried over from January, but I wanted to highlight that I've been working on ways to better assist people with functional needs and enhance the translational services for our emergency preparedness, so for the shelter drill or for the flu clinic, that kind of thing. So I've just been working on that. And
Fantastic.
That was my question. Would you define translational service protocols?
So.
I just
we're-
think everybody should know
working
about
on
that.
it. So I've made instructions on how to use Google Translate, so that, and we've got that put on the iPad right now, so where I'm, it's training people, our volunteers on how to use that. We've got, what's that thing called? The
Oh, show me app.
The Show Me app, so we've got that, so that's, it's got pictures, people can point out, it says, wait in line, or I need assistance, things like that, so, there's a lot of different, I've just started researching this, so.
Outstanding. Thank you.
So, since we're talking about functional stuff that you're doing, I'd like to raise a potential project idea with you. Okay. So I went to a meeting last week in Atlanta. It was actually my society meeting for post-acute and long-term care. But somebody from the CDC came to give a talk on Alzheimer's disease and related dementias, which is sometimes referred to as ADRD, Alzheimer's disease and related dementias. And the CDC is looking at ADRD as a public health issue. It's actually calling it a public health issue. They have a whole bunch of literature. They have some, their website is just replete with information, guidelines. The whole idea is if we can help address or help make sure folks are safe in their community and in their homes, that we can reduce the risk of bad outcomes moving forward. So I don't know what this means to us. We had talked about a screening tool a while ago. I'm not sure, but I was wondering, would you consider going onto the CDC site, the Centers for Disease Control, for Alzheimer's disease and related dementias, and just seeing what they have to say with regard to their issues around it being a public health concern, and see if there is anything that we can adopt or support or align in our town?
Mr. Chairman, so I did see your email. I forwarded it to Chris Pollock, the public health nurse.
Oh, great.
And I tasked her with taking a look at it and possibly coming up with some kind of
Oh,
program,
okay.
new program for the nursing department around that. And, but Sam can certainly work with her on it.
Yeah,
if
no, I mean, when we talk about function and cognition often go together with regard to total, we're talking about elders typically, although ADRD can affect the younger population as well. But the greatest risk factor for ADRD is advancing age. So, great, maybe it could be a team effort.
Yeah, and Sam is, I mean, not Sam, Chris is currently working on the shelter, health, or first aid and functional needs, assisting people with functional needs in a shelter situation. So she's coming up with a protocol for
Great.
that as well. So maybe that can be tied into it too.
And something I had raised with, I think it was Jim Tiggis, who's our selectman, but many years ago, was having more training for our civil servants, fire and police, with regard to cognitive issues and how to approach folks who have cognitive issues. And so I'm wondering if maybe we can work together along those lines too with our civil servants who do such a wonderful job for us. Anyway, I threw it out there. I thought it was very interesting. I didn't realize that the CDC was so involved in this, but they are, and they have some great things on their website. So I just throw that out there.
Thank you.
Any other questions for our Mrs. Welsh?
You have an investigation with Shaw's for trash. Was that in, I'm just curious, was it in the dumpster, was it in the lot? What?
It's trash blowing
Oh, okay.
on the other side of their fence, and it's kind of a, confusing location because it's in between two properties. And so we've been working with them to try and, fix.
For a long time.
Yeah.
Okay, I didn't know if it was, I know we've had stuff in the past with the dumpster, and I didn't know if that was,
Yeah, there was a little bit of a confusion on where the trash was. There's two different spots in their lot, so we've now addressed both.
we're working. Thank you.
So,
Okay, thanks.
Any other questions for our Associate Health Inspector? If not, the Chair will entertain a motion to approve her report.
I'll make a motion to approve the Associate Health Inspector's report.
Second?
Motion and second. Is there any further discussion? Seeing none, all in favor?
Aye.
3-0. Thank you, Samantha. Director.
Yeah, so I just have a couple things to add too about what we already discussed. Marlene and Samantha have been doing an amazing job with the new food code. I mean, there's a lot of information there and a lot of things to go over. And they've gone through everything, and they work really well together on trying to talk through issues and problems, and so I think it's worked really well, and they're doing a great job. So I just wanted to say that.
Thank you both.
And also, with Sam's translation services, we did have someone come into the nurse's office looking for a vaccine who didn't speak English. The parents were there with the high school students. So she assisted the nurse in doing translation services for them so that they could receive their vaccine. So it
Fantastic.
worked out really well.
That's awesome.
Yeah.
We're a very diverse
That's-
community.
That's awesome. That would make a great, I think that'd make a great BCAT article.
Yes.
Just saying. Awesome.
And we had a problem today in town.
Are you talking about so that was Christine did that, was from the Wendy's.
The water.
That was a different problem.
That was a different
The
problem.
water.
Over at,
We had a closure
across
of,
from the.
Oh,
district.
the
Closure.
water main break, yes, that was this, we found out about that this morning, and we called them up to make sure that they were closed, and Sam called them all, and I believe they were all closed,
Awesome.
yeah. A reminder, we have the MRC meeting tomorrow night. BCAT is gonna be there, Chris Pollock is doing a presentation on community preparedness, so they are gonna tape the whole, presentation and put it on BCAT and stream it, so that's great. So if a member of the public who can't come to our meeting can learn about community preparedness, through BCAT. One of the things that I also wanted to mention that I was looking at was, right now, we do a monthly Medical Reserve Corps newsletter. And in that, we do various articles, and the staff contributes to that as well. So what I would like to do would be to start using those staff articles in different ways, to use it within the MRC newsletter, but then also to publish it in the weekly paper as an article or, informational article from a staff member from the Board of Health. And it can be seasonal or whatever it is that they choose to do it on, but just to get, people more knowledgeable about what we do with the Board of Health in all the different areas. And then in the third way, use that article on social media, so Sam can then take it and put it out on social media. So we have 3 different mechanisms to kind of try and get the information out. So I'd like to start doing that. And if any of the board members want to do an article, I plan on doing an article and then doing like a headshot with a little bio. And if you'd like to do an article, I can send it off to the paper. We'll put it in our MRC newsletter and put it out on social media as well.
Cool. Very cool.
And I also wanted to mention, I got a call from Pat Iyer. She's the DPH TB program lead nurse, and she wanted to congratulate the board. She's doing a talk on innovative ways to adhere to the TB regulations when you don't have a public health nurse. So she called us to congratulate us on how we did that. When we didn't have a public health nurse, we used one of our MRC volunteers and got the call out to them and had her come in on a part-time basis. So it was Carolyn Abruzzo. And it worked out really well. So she just wanted to congratulate us on using an innovative or new way that she had never heard of to kind of get somebody in and do TB case management.
That's great.
So she's gonna be giving a talk on that. She'll be mentioning the town of Burlington in that.
Director, we, it's come to our attention that senior leadership in our town has some concerns or questions or confusion with regard to the Board of Health as an investigational and advocate for code and regulations versus the Board of Health as an enforcement agency, so, of which we are not. So we have had issues with inappropriate sump pumping, and throughout the town, not just localized in any one area. And can you please remind us again the process by which the Board of Health investigates or assesses issues or concerns that may violate policies or regulations when they arise?
Okay, so we have a process for doing investigations or investigating complaints. So when someone calls or emails the Board of Health office, we take that in as an investigation, and then we give it to one of the inspectors. So in the case of a sump pump complaint, we would take it in, we have a database that kind of tracks all of our complaints. We have a form that we fill it out on. We take the information from the complainant, which all that information is kept confidential. And then the investigator will get that form and then go out and do the investigation. So in a sump pump complaint, that would go to the environmental engineer to conduct the investigation. So she would go out and assess to see if there's a violation. If there is a violation, we write what's called an order letter. And an order letter states the specific section of the regulation that they are violating. And it also states their rights, and it states the potential penalties if they don't adhere. So we do that for all of our regulations, housing, drainage, a nuisance, anything that we're gonna investigate, and it's in violation, we will write an order letter. So when the order letter goes out, we give them a specific amount of time to correct. So in the case of a sump pump, we would write the order letter, we send it via constable to the violator, so that we know when they got it, and they need to correct it in a certain amount of time. In this case, I believe it's right away, so we might give them 24 hours or so to do the correction. Then we go back and do a re-inspection to make sure that they are complying. So if they are not in compliance upon re-inspection, then we can make the decision of whether or not to fine them. So we might give a fine on the second inspection, and then, subsequently go out again and make sure that if they are in compliance.
And then,
And then,
because I think that certain other boards need to understand that we can't go break down the doors, and we can't,
Turn off their water.
turn off their water. Please continue on what we are doing now and to the lengths that we have gone to fulfill our responsibilities.
so if the fine is not paid, the homeowner can then, or whoever the violator is, can decide, okay, I'm going to pay this fine, and then that would be the end of it, or not pay the fine. They could contest it. If they decide to contest it, then it goes to the court, and then we have a court date, we go into court, and we have a hearing with the magistrate. And then the magistrate decides, whether or not they're going to be held to the fine or not.
And the
And
magistrate,
each complaint is a separate investigation. So if we get a complaint today and, it gets closed out, because we've sent an order letter, and then we get a complaint 2 weeks on the same one, we would start the process all over again. So we go out and we do another investigation, we put it on a spreadsheet, we document each one that we get as a complaint investigation. It goes into our file, each complaint investigation that we get.
and the courts can find in favor of the homeowner and say, they don't have to pay,
Right.
or we're out of line, or the town can't enforce it.
Well,
We've had experience in that, many experiences in that area where the magistrate just kind of says, well, what do you want me to do?
the magistrate could forgive the fine, but then, if it happens again, the Board of Health still has the right to enforce their regulations and fine again, if that's the.
So the take-home is that the board is not an impotent body. The board has the ability to do many things, but the board is not an enforcement agency to that extent where it issues punishment, things like that, other than a fine.
We can only enforce what's in the particular
But-
regulation. So with regards to the stormwater regulations, it's non-criminal disposition fine. That's how it's enforced.
So if a homeowner is in violation of a regulation that the Board of Health oversees and the Board of Health investigates, and as a consequence, however, of ongoing violations, there is harm that is done. That's the responsibility of the homeowner who's been advised, and it's not the responsibility of the town or the Board of Health or things like that. Okay. Any other thoughts, questions on that?
No, I think it's covered.
I think it's clear. Thank you
I think
very
it's
much,
clear.
Director.
I just need the Director of Public Health to please report on the disposition of where we are with the Board of Health budget.
So, we have gone to Ways and Means and, got a favorable recommendation on our budget. With regards to our warrant article, we are going to capital budget subcommittee meeting tonight, where we'll discuss that, and they will provide a recommendation to go to town meeting. And then we also need to go to the capital, go back to Ways and Means for the warrant article at a separate meeting, and I believe they said that would be sometime in April. So we go to that and then town meeting in May.
And I
Great.
think, I'd just like to say that our subcommittee from Ways and Means was very professional and very helpful, as was Ways and Means this year.
We enjoy working with Ways and Means. They're a diligent body, so thank you for that. Any other questions for our director?
Mr. Chairman, I move we approve the Director of Public Health report.
A second?
Motion is second. Is there any further discussion? Seeing none, all in favor?
Aye.
3-0. Any other issues or concerns, new business to bring before the board? If not, the chair will entertain a motion to adjourn.
So move, Mr. Chairman.
We are adjourned. Good night, everyone. Hand washing, be safe.